Welcome to Healthy Frontiers. My name is Dr. Bizzoni and I'm a chiropractor. This show is dedicated to the education of our viewers. And the topic for tonight is arthritis breakthrough, synthetic cartilage implant. And my special guest is Dr. Peden. Let me tell you a little bit about Dr. Peden and what we're going to talk about tonight. According to the CDC, 23% of all adults in the United States, nearly 54 million people, suffer from some form of arthritis. Until recently, there's been no cure for arthritis. The only treatment was to minimize pain and preserve existing joint function, mobility, and quality of life. People just had to learn to live with it. That could be about to change. In July of 2016, the FDA approved the use of synthetic cartilage implants for the big toe joint. And our guest today, Dr. Peden of ONS, is one of the few orthopedic foot and ankle surgeons in the country who uses this implant in surgery with incredible results, by the way. Dr. Peden is a board-certified orthopedic foot and ankle surgeon at ONS. That's orthopedic and neurosurgery specialists who have offices in Harrison, Greenwich, and in Stanford. Dr. Peden earned his medical degree at Washington University in the St. Louis School of Medicine and did his residency in orthopedic surgery at the George Washington University. He's completed fellowship training in operative and non-operative care of the foot and ankle with Michigan International Foot and Ankle Center, and in addition, completed an AO fellowship, a renowned program for orthopedic trauma surgery. So I'd like to welcome Dr. Peden to the show.
Thank you very much for having me.
Welcome, Doc. We have some great questions. You got a new cutting-edge technique, and let's talk about it.
Absolutely. So, yeah, I mean,
cartilage implant. What is that?
So it's a new type of device, typically for arthritis, which is where the joint wears down and basically the lining of the joint, the cartilage starts to break down and degenerate.
Yeah.
Your options were to live with it or have a joint replacement, which was usually made from metal and plastic.
Right.
And what a synthetic cartilage implant is, using the same material that you find in contact lenses and in heart valves, and using that for its mechanical properties and how it can mimic cartilage.
Yeah, sure. Okay, so, and what is it made of and why does it work?
So it's a polyvinyl alcohol. It's 60% polyvinyl alcohol, which is basically a plastic.
Right.
And 40% saline or salt water.
Mm-hmm.
And it's, like I told you before, same material in contact lenses. And so it's very well tolerated by the body. It really doesn't integrate with the body. It actually just kind of sits on top of surfaces and therefore doesn't get a foreign body reaction the way a piece of metal can often cause an irritation or an inflammatory reaction. Right. And the reason it works so well is because it mimics cartilage in two ways. So the two main functions of cartilage are shock absorption. So when you're running and jumping and you're landing on your knee, your cartilage needs to absorb that shock, kind of like the tire on your car absorbs a bump.
Right.
And similarly, it needs to have good, smooth movement. So a joint needs to be able to both absorb shock as well as move well. And what we found is that this particular material really mimics those properties in terms of its compressibility, its shock absorption, as well as its ability to move smoothly through a range of motion, meaning, you know, just the same as with your knee, bending and straightening your knee.
Sure, and that differs from, most people would be familiar with like a titanium implant, right?
Yep.
You would just say in the metal, that's the metal we were
Exactly.
talking about?
Yes, exactly. Yeah. Things like cobalt, chrome alloys, stainless steel, and titanium. There's none of that in this particular procedure.
Great. So what's involved in the surgical procedure, Doc?
So just to back off, the real problem that we're talking about here is arthritis in the first big toe joint.
Why don't we stop there and just ask and explain to the audience, what is arthritis?
Sure.
You know?
So what arthritis is, and we're looking over here?
Yeah, you're looking to me.
Oh, looking at you.
Yep.
Sorry. Is arthritis in the big toe is called hallux rigidus or hallux limitus. Those are just two Latin names for arthritis of the big toe. Right. And what those things are is when the cartilage breaks down in those joints. And so what a patient typically complains of is pain directly over the main joint in the big toe.
Yeah.
Kind of, sometimes they can have a big growth or a bone spur there, and that bone spur is a reaction to the cartilage wearing down. Right. So those patients typically have pain and stiffness in that joint, and so difficulty with walking. It's really, really common. X-ray wise, up to 50% of patients have it as they age, but only about 20% of those patients are symptomatic.
Right.
So, you know, for those patients, never have to have any surgery.
Right.
If it's just a mild soreness, sometimes just changing your footwear or taking an anti-inflammatory medication is enough to keep the problem manageable. And if it's manageable, then we do nothing about it. But for the patients where it's not manageable, then we have options like cortisone injections, other kinds of stem cell type injections, and those are obviously very easy from a recovery standpoint and low risk, but sometimes aren't sufficient to relieve the pain. And then for those patients where the pain is ongoing and severe and nothing else is working, you basically, prior to a few years ago, I had two options in my toolbox, basically. One was to clean up the arthritis, which basically means removing the bone spurs and trying to stimulate new cartilage to grow. And it sounds really good, but the results are about 80% pain relief. So good, but not perfect.
Got it.
And then the other option is something called an arthrodesis, which is a fancy term for fusing or welding the joint together. So I've been talking about the knee a little bit. An analogy is in the knee. If you had arthritis in your knee, you might have a cortisone shot. And if that doesn't work and you've got a lot of bone spurs, maybe an arthroscopic surgery to clean up the arthritis. And if that didn't work, your options would be possibly a joint replacement or to live with it. And a joint replacement in the knee is 100% necessary because you can't live with a stiff knee.
Right.
Whereas in the big toe, with a fusion procedure, patients do get pretty good pain relief, but most patients don't want a fusion, especially female patients, people who are active in athletics or yoga. You want to be able to move that joint. You want to be able to wear a shoe with a moderate size heel, and that's a big part of my job. Getting people back to normal footwear really makes them feel like they're
back to their normal lifestyle and not have to think about it.
Exactly.
Great. So let's get back to the question of the surgery. So what's involved with a surgical procedure then?
So what's involved in the procedure is a small incision over the top of the joint, basically the joint that's arthritic, removing some of the bone spurs, and then replacing a small portion of that joint with this implant. The implant, the best analogy I can use for you is it kind of looks like an eraser tip on one of those old No. 2 style pencils. That eraser, it's a little bigger than that, and it's clear. It's made of, looks kind of like a contact lens, only that shape. And that is implanted in the area on the joint where the cartilage is worn down. Or it's basically exposed bone, like you'll hear bone-on-bone arthritis. Well, that implant is now covering that exposed bone. And it's even, we leave it what we call proud, which means sticking out a couple millimeters, so it provides both a little space between, so you're not rubbing bone on bone, plus it provides the cushioning and the wear properties so that the joint can move.
Great. So is this an outpatient procedure? Are you in the hospital? What's the procedure?
So it's an outpatient procedure. We typically do it under a regional anesthetic, which means you're numb from the knee down through the toe. And then you have a light sedation so you sleep and you're not aware. And you know, some patients will want to stay awake, and they can, but most patients it's better they just rest, and that way they don't move.
Right.
And the procedure takes about 35 minutes. It's really very simple because there's just one implant. There's no cement involved. There's not a lot of work involved. From my point of view, it's very straightforward. You make basically a hole for that eraser tip to go into, and then you put it in, and if you do it right, it takes 30 to 35 minutes. You have about 5 to 10 stitches at the most over the top of your toe. You have a soft dressing on after the procedure, and then you go home shortly thereafter.
Wow. And is there any rehabilitation that you need to do, or?
So with most patients, first of all, in the foot, in general, people tend to get pretty sore after foot surgery, and I like to be very straightforward and honest with my patients. For the first couple of weeks, it's best to just really take it easy, put your foot up. You can put weight on it to get around the house and you know, go to the bathroom and do things like that, but you're not going to be running around. And so for the first couple of weeks, you just want your incision to heal quickly and basically the swelling to go down, and then after that, you can get right back on your feet and start walking on it. As far as physical therapy, it's not critical for this particular procedure because it's basically all the movement and the strength come back on its own because you are able to rehab it very quickly. You can get back up on your feet within a week or two and putting weight on it. And I would say about half the patients will go to physical therapy if they're having problems with stiffness or if you know, they get soreness in other parts of their leg because they're walking differently.
Yeah, sometimes they come to me because their back gets thrown out because their gait's off a little bit.
Happens.
You know, it happens.
Does happen.
I'm sure not frequently, but there you go. So does this option replace the more traditional procedures for that condition?
It does, yeah.
Yeah.
It does. There were some patients where they had severe arthritis in their joint and they did not want a fusion, either because of how it sounds, and it sounds bad. Nobody wants to have their joint fused,
Right.
or because they wanted to preserve some motion, and they would just have to live with it. So for that group of patients where I might have talked them into a fusion just to help them with pain,
Yes.
and help them be able to walk more normally and pain-free, now they can have this procedure with very good results. And it also replaces the other procedure I mentioned, which is the cleanup procedure for some patients, where I think I'm going to be able to help them maybe go from, if they gave, if they gave their foot a score of let's say a C minus, I can make them a B plus.
Right.
Now instead of the B plus, we're more likely to shoot for that A or A plus, which is the
Sounds
way
exciting.
Yeah,
It really is. Okay. So what's I guess we talked about that, the post-surgical recovery for the surgery.
Yeah.
But what are the benefits to patients and over the other toe surgeries?
The major benefit, well, everything we want to do is focused on pain relief. Right. And the major benefit is that it shows excellent pain relief relative to the gold standard procedure, which is a fusion procedure in this particular area. And that pain relief is 90-95% or greater. And that ability to relieve their pain helps everything up and down the leg in terms of, and back and so on and so forth. Because now they can walk more normally, they can put their foot down flat, they can push off through their toes, and they're not putting additional strain on their knee, hip, back, and all the way up the body. So that's the number one benefit. Compared to other previous joint replacements, and I want to be clear about a couple things. Number one, I don't have any stock or financial interest in this product.
Got it.
I just like it because it's a great, exciting new thing to offer my patients. Sure. But the previous joint replacement options were very much more like a joint replacement of the knee. And the problem with those is that with the knee, you're talking about replacing the surface of your femur and your tibia, and those are two big, strong bones. The femur, the largest bone in your body, and the tibia is a solid bone. And putting a metal joint replacement into the small bones of the toe, the metatarsal and the phalanx, they often loosened, they often fractured even through those bones, and those previous forms of joint replacements had miserable results.
Right.
And so I never did those, just because those results were so bad. And one of the major benefits of this particular joint replacement is that, I always tell patients this, and we're always planning ahead as surgeons. We don't like to leave ourselves with a dead end or no way out of things. And in the major research study that was done for this product, it's called Cartiva, is in that study, about 10% of patients from 5 years from the procedure had ongoing pain. So about a 90% success rate, and we're talking about hundreds of patients. And in those patients, you could either redo it, or you could then go on to fuse the joint with excellent results. Whereas in those previous patients I was talking about a moment ago, where they had the more traditional joint replacement, you're really left with very poor options.
Right.
It's hard to get it to fuse properly if you've already had to resect previous areas of bone. And those patients have much bigger problems. And I know, I see some of those patients that have come to me from other doctors with those joint, and so it's really great. And the other things are preservation of motion. You get better motion than you would with a fusion, obviously. You don't only preserve their motion, but you increase their motion on an average of 10 degrees increase of motion in the joint.
So breaking down right there for a while.
Exactly. And then last, I'd say that it's a pretty easy recovery too. A lot of these patients are in their 50s, 60s, 70s, and it's hard to be on crutches. It's hard to ride around on a scooter. With this procedure, you can bear weight, meaning put your foot down on the ground for balance and for walking as soon as a few days after surgery. And so it's a much easier recovery.
That sounds great. So with so many people suffering from arthritis in joints all over the body, all right, why was this only approved for the big toe?
Well, the FDA approval, is a very rigorous process. And this product has been around for quite some time in other countries just because of the fact that getting things on the market in other areas is much easier. In the United States, this is the only thing that it's achieved FDA approval for, but what I can tell you is stay tuned, because the product is being researched currently for uses in the knee, uses in other joints in the foot,
Yep.
and I think it's going to have a very, it's what I
getting
can tell
legs
you.
now.
It is.
Yeah.
Well, so it's a very small company too, and they have not sold out to any other bigger company, and I think
Yeah.
that's because they want to apply it for more conditions.
Yes.
And if it works half as well as it has for the big toe joint, it's going to be a very useful product.
So it's been around since 2016 here in the United States. Is
That's
that what
right.
you're saying?
Yep.
So that's really pretty new. You know?
It is new. It's
It
been
is, yep.
used since 2002 in Europe, Canada, and Brazil.
Right.
And over 5,000 of the implants have been placed already, and it's been followed very closely, as all
Right.
implants have to, followed very closely with excellent results.
Sure.
And so while it is new, I've known about this thing for years
Yes.
prior to its FDA approval, and when it did come out, I was eager to start using it. And you know, my partner and I have done more of these than pretty much anybody in the area, and
Yep.
so far we're seeing excellent results, and we're
Great.
very, very satisfied, as are our patients.
It's got to be exciting, you know,
Yes.
and looking forward to using it in other joints. I mean, it's great for the world.
Yes,
So-
exactly.
So it's been used elsewhere in the world prior to getting FDA approval, correct?
That's right.
And it was, you said, Canada and...
Canada, Europe, and Brazil since 2002, so a
Okay.
while now.
So
So
it's
it's
got
got a
full-
long track record,
Sure.
and it seems these things seem to hold up. You know, you think, why don't they wear down like other things? Knee replacements, on average, wear down after about 20 to 25 years, which
Yes.
is pretty darn impressive.
Yes.
These things, you know, we haven't seen a lot of them wear. The biggest problem we've seen is that, remember how I said we leave it a little bit proud or sticking out? In some patients, we'll see that over time it'll settle down, and so it's kind of not sticking out and providing that cushion anymore.
Yeah, yeah.
And that's where most of those 10% of patients who've had so-so results,
Sure.
we think are coming from. But it really doesn't seem to wear the way that our cartilage does.
Yeah.
The stuff that
That's great.
we're born with.
Oh, yeah.
Yeah.
That's great. So does it have potential? You said it does for other large joints, right? And how about shoulder? Does that, are we thinking about that for
Yeah.
shoulder, knee,
Absolutely.
elbow? You know,
I think the possibilities are limitless in terms of, you know, those joints are a little more complex than this joint. The first toe joint is really just a straight up and down hinge joint.
Yeah.
The shoulder is by far the most complex joint in the body.
Sure.
In terms of its range of motion, you know, as opposed to just a simple hinge like a door. But I think it certainly would have possibility and potential to really help people, especially with an isolated area where the cartilage is worn, to replace that area with a cushion or a bumper or however you want to
Yeah.
put it. With this Cartiva implant, certainly has some possibility. And so, you know, everybody asks me, they say, well, is there a cure for arthritis? And why can't we regrow the cartilage? Just like when you break your arm,
Yeah.
it heals, it grows back.
Yeah.
Or you pull a muscle, it heals, it grows back. Cartilage doesn't grow back. And the reason for that is it doesn't have a blood supply.
Right.
Cartilage gets its nutrition through synovial fluid, and so it just doesn't heal, and that is an area of ongoing research. But what this does is basically replace your cartilage as opposed to having to replace your entire joint.
yeah. I mean, so apropos to what we do, it just discs in your back are made of cartilage, and you know, I tell patients all the time. I said, you know, that's why it's difficult. You know, try to prevent it from keep breaking down because you're going to have trouble.
Yes,
it
prevention.
doesn't. It's not going to redo itself.
Yes, exactly.
You know, so okay, so. Can we just talk for a few minutes
Sure.
about arthritis and what should people look for? I mean, what would be the first sign? Is it just like a little pain? Is it something, shooting pain, dull ache? I mean, what are in their toe? What would you, what are they looking for to say, you know, something's going on? And how long would they have it before they maybe give you a call to look at it?
Yeah, so it's patient to patient dependent.
of course.
Often the first thing they'll notice is that the arthritis tends to affect the top, or what we call the dorsal part of the joint first, so the part that kind of rubs on the top of your shoe.
Okay.
So they'll often feel a pain in that area and a bump, and some people will even call it a bunion.
Okay.
Bunions is another type of surgery I do a lot of, but
Okay.
really kind of different. It's more a bump on the inside of the toe.
Right.
This is a bump on the top of the toe that's red and inflamed. And so what most patients will notice is that they have some pain.
Right.
And some swelling, or almost what feels like a bump or a bone spur on the top of their toe, and then often some stiffness.
Yeah.
Some patients actually have that bone spur or that bump, but it's asymptomatic, and whatever it is that they have,
Yeah.
it's not well understood by science,
Yes.
but they're able to live with it in a way where other patients have that same bump and it's painful.
Is there any hereditary factor to toe arthritis? Or
There is actually.
Yep.
It's based on the shape of your joint that you're born with, and some people are just more prone to it. It's also based on the shape of your foot or your arch,
Okay.
and whether you have more
Yeah.
direction pointing down puts more force on it.
Right.
The other major risk factor for this problem, arthritis in the big toe joint, is the presence of a previous injury, a fracture or a bad sprain. A bad sprain of the big toe we call turf toe, based on back in the day when the original AstroTurf came out. It was hard as a rock, and patients, it was a very common football injury where they would hyperextend that joint and damage the ligaments. And then when you lose the function of the ligaments, just like if you lose the function of your ligaments in your knee, your ACL goes, your risk of developing arthritis down the road goes up. So that's the two main risk factors are the shape of your joint, which is definitely hereditary. And the other main risk factor is that history of a bad injury, either a fracture or a bad sprain of the joint. In terms of other things where it's not clear, you know, is running bad for this arthritis? It doesn't seem to cause it. What it can do is take a case that's relatively calm or asymptomatic and turn it and make it symptomatic. So I believe people should stay active, and you know, losing weight can have a major impact on all your joints in your body, and particularly your foot. You know, if you lose 1 pound in the upper body, that's the equivalent of dropping 6 pounds of pressure off your foot. So I always tell people to keep doing things that keep them in shape and happy and active, but some stuff like certain shoes, really high heel shoes, which really put a lot of strain on that joint, or running in really thin, light shoes can put a lot more force on it and make a problem that's minor into a big problem.
Then they won't have to come and see you, right? If
Exactly.
they take care of themselves,
No,
right?
I mean, that's what we want.
You want prevention. I know your whole group is all about that. Prevention
Yes.
first, and then if we need to do it, let's do it. So
yeah, the way our group is set up is very unique. When I was looking for practices to join, we are not about surgery first. While we are surgeons and we like to help people, we're more about trying to make a simple, quick lifestyle or activity modification that can keep you going without having to have the major risk involved in some of these surgeries. The good news is a lot of the surgeries I do have very minor risks, and so if it doesn't work, we can always fix it. But it's better to try something simple first, right?
Yeah, for sure, for sure. Hey, Doc, it was great. You have any last comments for the audience, or?
Absolutely not. No, I had a great time talking with you.
I think you covered everything really great. So I want to thank Doc for being on the show.
Pleasure to be here.
And look forward to seeing you again.
Great.
Okay? Take care. Good night.